Now, as COVID cases surge across Europe, some countries are introducing targeted measures against the unvaccinated. Austria has taken the hardest line yet, putting its unvaccinated population under a 10-day nationwide lockdown. Joining us now is Jennifer Rohn. She's head of the Centre for Urological Biology at University College London. Very good to speak to you, Professor Rohn. Thanks very much for joining us. So we're seeing a lot of these measures being brought in across various parts of Europe, are sort of dividing up between those who are vaccinated and those who aren't. The idea of this policy is it encourages more of the unvaccinated to seek the vaccine. Is it being successful if that is the goal?
I mean, there's evidence that restricting people who don't have the vaccine does work. So it worked for France, for example. They had it was very unpopular. They brought in the vaccine mandate, and lo and behold, many people got vaccinated and their cases went down. This was in the past, of course. So it is obviously a powerful incentive if you've been under restrictions for more than a year. And it should work as well, because onward transmission is obviously a big problem in Europe now. We're getting lots of surges.
Good morning, Jennifer. I'm just one of the questions I think everyone is wondering about is that, we're seeing some countries that aren't yet seeing that surge in Europe or a little bit behind in that surge. Is this just a matter of time? Is every European nation going to go through an extreme winter spike, or are some of them genuinely handling it much better?
It's a really interesting what's happening. So obviously in countries like Eastern Europe, so Bulgaria, Romania, the reason why they're having a surge is simply lack of vaccine coverage. Only 20 to 30% of their population is vaccinated because they just don't fancy having it. Whereas you've got countries like Germany, which have excellent coverage. About 70% of the population has been vaccinated, yet we're seeing a surge there. So I do think one of the reasons is probably that the vaccine is waning with time. And if you don't have an effective booster program in place, for example, AstraZeneca starts out at about 63% effective, goes down to 47% after 20 weeks. So without that booster, I think that early adopters of the vaccine will start to wane in immunity. And then, of course, we're in winter where nobody expected this to be an easy winter.
Yeah, the difference in the timing of the booster and the take-up of the booster certainly being talked about here in the UK, Jennifer, is something that explains some of the data differences we're seeing across the channel, by some at least. How much of a game changer are COVID pills? So those being created by Merck or by Pfizer, are they a game changer for you, Jennifer, as we head into 22, or do they just help at the margin?
Well, it's certainly promising. We have to keep in mind that these drugs have been announced by press release. The data have not been examined or peer-reviewed. But it does look as if they prevent hospitalizations and deaths. However, they were all tested on unvaccinated people. So whether, if everyone has a vaccine, will these pills add anything on top of that? It's difficult to say at the moment. We just don't have the data.
Jennifer, there's obviously this big focus on boosters, which makes sense, but is this going to worsen the supply shortage of first-round vaccines for a lot of the developed world? And many people argued that that's the problem for the whole globe moving beyond the vaccine, that we need to get much of the world vaccinated and not just focused on individual countries.
Obviously, you've hit the nail on the head. As long as the entire world is not vaccinated or protected, we are all vulnerable to the rising up of new variants that breed under these conditions. However, it's really difficult, isn't it? Because countries who can afford boosters, you can see what's happening without them. And so the vaccines are becoming less effective and people want to protect their own. So it's always been like this. And until we ramp up the supply of all the vaccines and you get them out there, this is going to be an issue.
What do we learn, Jennifer, from the experience of countries that have high levels of antibodies about how you learn to live with COVID-19? Because I'm thinking about the difference between, say, the UK, where 93% of adults, and this is maybe a month or so old, this statistic, but 93% of adults in England had COVID antibodies, and that was either through the vaccine or through having been infected by the virus. And I think that was at the beginning of September. But we still have so many cases of COVID. We don't have anything like the hospitalizations and the deaths that we did have, but we still have quite a lot of those as well. If you try to translate that experience into countries that have previously had zero tolerance for COVID cases, how do those countries ever open up to the rest of the world?
It is really interesting. The UK is a fascinating case where we've been having incredibly high rates, but for a very long time. It's not going up, it's not going down, it's just sort of tootling along. Very interesting, probably because the virus is washing up against a shore of massive immunity. But maybe because we let it rip in the summer, maybe this is what's happened. We flattened the curve. We've got high cases that are not going up. I think that countries that are restricting access to interacting with other people may well have lower immunity because of that. So natural immunity, and perhaps the UK has a combination of vaccinated and natural immunity, and that's preventing the cases from surging even further. But you can't make any predictions. It could be that the UK will get into trouble within the next few months because of the winter season. We just don't know how long this odd plateau is going to last.